Good morning, everyone. Thanks for joining us today. My name is Rebecca Brennan, and I have the privilege of serving as Interim Chief Executive Officer at Lifelong Access. It's an honor to share this moment with all of you. At Lifelong Access, we're deeply committed to supporting children, teens, and adults with mental health needs, intellectual and developmental disabilities, and other challenges. We strive to provide essential services that foster independence, growth, and inclusion. The work that we do is the heart and soul of our mission to build a stronger and more connected community. We are proud to be one of the 13 recipients of the Healthcare Transformation Capital Investment Grant, receiving $21.7 million to expand access to critical services. I want to extend my gratitude to Governor J.B. Pritzker, the Illinois Department of Healthcare and Family Services, and the Developmental Capital Board for their leadership and vision in making this funding possible. I would also like to acknowledge our outstanding partners. We have Dave Shurar and Praneet Lika of Chestnut Healthcare Systems, as well as Mark Jontry from the Regional Office of Education for their collaboration and dedication to our shared mission. And a special thank you to Senator Kaler and Representative Chung for their unwavering support to this project and the commitment to our community. This funding represents more than just financial support. It advances our mission in transformative ways while contributing to the revitalization of Bloomington. By transforming the historic Panagraph building into a vibrant hub for care, support, and community connection, we are creating more than a space. We are renewing hope and opportunity for those we serve. So finally, it's my great privilege to introduce someone whose leadership has been instrumental in bringing initiatives like the Healthcare Transformation Capital Investment Program to life. Please welcome Please join me in welcoming Governor J.B. Pritzker.
Thank you, I get tripped up too. Plus, it's early in the year. So thank you so much, Rebecca. Thank you, and really thank you to all the folks here at Lifelong Access and to the many recipients of these grants that are here with us today. The work that you do is so vitally important for the state of Illinois, for the people of the state of Illinois. We rely upon you, and we're counting on you, and we're excited to be investing in you. Once again, the work that gets done right here at Lifelong Access is vital, not just to the people who live here and work here, but their families, and also sets an example for other organizations and other folks around the country who are looking to how do you solve real problems and challenges that are facing people in the human services arena. I also want to thank some of our great partners from across government who really have helped to make today possible and helped us shape these programs. Let me begin, of course, with our friend, Normal Mayor Chris Coos, and McLean County Board Chair Lizzie Johnston, relatively new to the position, but very glad to have her in leadership and to be able to work with her. Our Illinois Department of Healthcare and Family Services Director, Lizzie Whitehorn. I just want to say, there's really nobody better that I've worked with who knows government well and who's taken over a department and done so much with it in such a short period of time. I also want to recognize our Illinois Capital Development Board Director, TJ Edwards. As you know, we've made massive investments across the state of Illinois, capital investments because of the capital bill that we were able to pass a few years ago. And it takes a really great capital development board to make that happen, and leadership at that board. So thank you to TJ. And of course, I want to recognize your great state representative, Sharon Chung. I want to emphasize to all of you who vote in this area and who vote in her district that sending great people to Springfield is vitally important. I'm looking at a former state representative who I also have great respect for, and know that the voters of this area understand what it means, that having good representation in Springfield makes a big difference. And for a governor to be able to rely on people from an area to tell me what it is that we need to do in the executive branch to help Bloomington Normal and your district means an awful lot. So I just want to thank you for sending Sharon and great leadership to Springfield to work with me. Over the past 6 years, we have undertaken really an ambitious effort to rebuild and revitalize healthcare across the state of Illinois, seeking to build a truly comprehensive care infrastructure everywhere. Comprehensive in reach so that every community can access quality, affordable care relatively close to home, and comprehensive in scope so that we are not only treating illnesses, but attacking the root causes of poor health outcomes. That has meant addressing a wide range of health-related social needs, including factors that extend outside a doctor's office, but have an undeniable impact on health that include things like housing, food insecurity, unemployment. Those are all things that feed into people's well-being and health. It has meant for us investing in healthcare infrastructure in communities that have been left out and left behind. Not just those communities, but importantly, those are communities that suffer the worst health outcomes and need the most help in these kind of underlying investments. That's why we're making this historic award of $200 million to 13 providers and organizations and projects that help us strengthen healthcare systems across Illinois. The Healthcare Transformation Capital Investment Grant Program is a first of its kind collaboration between the Illinois Department of Healthcare and Family Services and the Capital Development Board that will award funding across 13 providers, organizations, projects to make healthcare more accessible and more affordable in the communities that they serve, not just now, but for many years to come. Lifelong access is a sterling example of our vision and the impact that organizations can have. This is a community institution that has provided support and development services in McLean County for over 60 years. Thanks to $22 million, almost $22 million in funding, Lifelong Access will provide a more comprehensive continuum of care through a robust new youth support center that includes mental health treatment, dental services, food security, youth education programs, and more for the people of this community. And I want to acknowledge a number of the partners who are helping to carry the Youth Support Center's mission forward. Chestnut Health Systems, the Regional Office of Education, number 17, Project Oz, Midwest Food Bank of Illinois, Bloomington Normal, and YWCA McLean County. All of you and others are the pieces of a puzzle that you've put together to help solve people's challenges in this community. The investments that we are making here are not only about better healthcare, but about community revitalization. Lifelong Access will have a home in the old Pantograph building, as was mentioned by Rebecca, a historic pillar of downtown Bloomington that has since been dormant for some time now, and will now become both a social services hub and an economic driver for downtown Bloomington. Now, this HTCI grant program broadly is making transformational investments and partnerships in communities all across Illinois. That includes funding for 6 safety net hospitals that are medical centers in underserved communities that provide health care to patients regardless of their insurance status or their ability to pay. I just want to emphasize how vitally important that kind of work is, because there are too many people that don't have health care coverage or don't know how to get it, but fall ill and then just need services right away. And so having a place for them to go and a hospital that will accept them means an awful lot. This grant program will also support our rural healthcare providers like the Clay County Health Department and the Aruka Institute of Healing, providing care to rural Illinoisans who often face the greatest hurdles to quality services. And we're deepening our focus on downstate mental health systems. investing in expanded psychiatric services in Southern Illinois, and projects like adolescent mental health wing that's being built at Touchette Regional Hospital, so that more downstate residents get access to these critical services. This has been overlooked for far too long, and we really have been ratably improving mental health care availability for people in areas where I think it's just been forgotten and left out. Outside of a hospital setting, our grants are also addressing root causes of health disparities through community-based institutions like a nutrition and wellness center on Chicago's South Side, a teaching kitchen on the North Side. Typically this involves, for example, people who have diabetes who just need to learn how to cook for themselves a meal that would be healthy. But a youth empowerment space in Bronzeville, and a family crisis workforce training center in Princeton. These will help create and uplift support systems that are absolutely critical for children and for families to lead healthy lives. This $200 million investment is intended to dramatically improve the quality of life for Illinoisans by bringing healthcare closer to home, accelerating economic development, and addressing root causes of healthcare challenges facing people across our state, especially downstate. And I want to express my pride in the advancements that Illinois has made to meet the needs of working families. And today's announcement is just another example of the positive direction that we intend to maintain for our entire state. And with that, I get to introduce someone who has dedicated her career to public service and who I've been proud to work with for the last 8 years directly. It's our outstanding HFS director, Lizzie Whitehorn. Lizzie.
Thank you, Governor. Good morning. I'm Lizzie Whitehorn, the Director of the Illinois Department of Healthcare and Family Services. First, I want to echo the Governor's thanks to Lifelong Access for hosting us today. Thank you also to all of our partners at the Capital Development Board, especially Director TJ Edwards. I'm also happy that Representative Chung could stay with us or be here with us instead of going off to Springfield this morning, and to have Mayor Coos joining us as well. I'm so excited to be with you to talk about the Healthcare Transformation Capital Grant Awards. Last month, Governor Pritzker, HFS, and CDB announced these awards totaling $200 million for 13 organizations. These grants will be funding capital projects to address health-related social needs and to reduce healthcare disparities in underserved communities, in furtherance of our ongoing priorities at HFS and complementing many other ongoing initiatives. For many years, researchers have known that if someone is not housed or can't access food, their health outcomes will be worse. Studies have repeatedly proven that social determinants of health factor heavily into an individual's health outcomes. The U.S. Department of Health and Human Services last fall issued a call to action to address health-related social needs in communities across the nation, citing research that shows social determinants of health account for about half of the variation in health outcomes in the nation. To that end, the projects receiving awards through this program range from renovating a church into a teaching kitchen, gathering space, and behavioral health program expansion on the north side of Chicago, to constructing a county health department building on the Clay County Medical Complex campus in southeastern Illinois. From developing a new comprehensive care center and community space on the south side of Chicago, to constructing a new adolescent mental health wing in Metro East. Here at Lifelong Access, a $22 million award will help purchase and renovate a building to serve as a collaborative hub for multiple community agencies that offer a range of services, including behavioral health and psychiatry, pediatric primary care, dental wellness, food security initiatives, and supported employment programming. This is the first time in 15 years that the state has implemented a capital investment program for healthcare and hospitals, and there was huge interest. I'm pleased to share that we received 52 applications. This particular program was designed to complement our Healthcare Transformation Collaboratives program, which was created by law, signed by Governor Pritzker in 2021. The HTC program funded partnerships anchored by safety net hospitals that bring together providers and community organizations to implement solutions to bridge healthcare delivery gaps in their communities. 6 of the 13 capital grant awardees represent healthcare transformation collaboratives. And as the governor mentioned, 6 of the awardees are also among the state's safety net facilities, which provide critical care in underserved communities with high rates of Medicaid utilization. Safety net entities represent almost half of the funding awards with these grants. All of the awardees demonstrated a strong vision for addressing health-related social needs and promoting equity in the healthcare system. Finally, I want to recognize that this is the first collaboration of its kind between HFS and CDB. I'm proud of this partnership, which allowed both agencies to use their expertise to award truly worthwhile projects. Congratulations to all of the awardees. We're so excited to continue to partner with you and to see progress on your projects. I'll now pass it over to Director Edwards.
Always the short one. Good morning, and thank you for joining us today. I think this is an amazing initiative that has been stated. It is an honor to stand here as the Executive Director for the Illinois Capital Development Board and be a part of this transformative initiative that will change the healthcare landscape across Illinois. Under Governor Pritzker's leadership, we continue to build a more equitable future for all Illinoisans. Today, with the announcement of the $200 million in healthcare transformation capital improvement grants, we are taking a historic step towards reducing healthcare disparities and improving access to care in underserved communities. This program represents the best of what collaboration can achieve. Together with the Illinois Department of Healthcare and Family Services, we have selected 13 outstanding projects that exemplify innovation, equity, and commitment to addressing the social determinants of health. From expanded mental health facilities in Southern Illinois to community-focused healthcare hubs on Chicago's south and north sides, these projects will create infrastructure that supports better healthcare outcomes for generations to come. Nearly half of this funding will go to safety net hospitals and health centers that serve as lifelines for communities facing the greatest challenges. CDB will manage the distribution of funds that provide investments that enhance the quality of care and foster economic growth. We are proud to oversee the successful execution of these projects, ensuring they are completed efficiently and with the highest standards. We are proving that Illinois is not just building new infrastructure, we are building hope, equity, and opportunity. Thank you to Governor Pritzker, HFS, our legislative partners, Representative Chung here today, and Mayor Coos, and the community organizations for making today possible. This is a pivotal moment in our shared journey to transform healthcare across our great state. Thank you, and I welcome up Mayor Coos to give comments.
Good morning, everyone, and it's a pleasure to be here. I'm going to start my comments with a little celebration of the home team, Lifelong Access. The amazing, amazing work that Lifelong Access has done in this community is truly inspirational, and we are proud of the town of Normal to be a part of that when we gave a $500,000 grant to Lifelong Access to acquire this building and expand their services. And they've taken that initiative and run with it and continue to expand services to this community. So my thanks to the staff of Lifelong Access, to the board members and the donors of Lifelong Access for realizing the important work that needs to be done in our community and for standing up to do it. You know, they say it takes a village to raise a child, but it takes a village to save a child too. And that's the work that Lifelong Access is doing in our community. And it's such a pleasure to realize, Governor Pritzker, you and your team recognize the work being done here and are stepping up to support the work that they do in our community and the broader area. We're thankful for the Healthcare Transformation Grant Program and the work the Illinois Department of Healthcare and Family Services has done to help with this program. Of course, the town of Normal and the entire Bloomington community, Bloomington, Normal, McLean County community will benefit from the work being done. So thank you again to all the partners, Chestnut Healthcare, Regional Planning, for partnering on this. We together as a community can make a difference for those who need to be helped in our community. And just a great day to have this announcement come forward. So thank you, and it's my pleasure to represent Sharon Chung, our local representative. Sharon?
Good morning. I guess, yeah, I was a little sold out that I'm supposed to be in Springfield right now. But when this press conference was scheduled, I did say that, you know, staff knows, so I'm not playing hooky too much. But I did say that, you know, this announcement is so important for me to not be here today. You know, it was just over a year ago, I think, was it, Puneet, where Senator Kaler and I met with folks from Lifelong Access and Chestnut and the Regional Office of Education, where they presented to us this idea for this project. And I remember saying to somebody, I don't know if it was to my chief of staff afterwards or something, but I basically said, like, if we can make this happen, this would be transformative. And how amazing is it that now we've received the Healthcare Transformation Grant? It seems very fitting. But, you know, for me, I think that just this project is all about community. We have people in the community who are doing the work every day, who recognize a need, and they present the need to myself, and then we try to get the ball rolling, and we got the governor and all the other departments involved. It's a real, true community effort, and then what we're then going to be doing is then to serve a really important part of our community. And so I see this program as, and this whole project as being sort of an intersection of all the things I love. I love healthcare access, I love uplifting youth, and I also really love, like, revitalization of historic buildings. So, you know, that's sort of, this really is the intersection of all the things that I really do care about. And I'm so happy and so thankful for everybody here who's been working on it, for the governor and his commitment to healthcare access, and congratulations to all the other award recipients who are here today. I'm really excited to see this get moving, and I guess I should probably get to Springfield here pretty soon. But thank you so much to everybody for coming out here today. And with that, I'm going to turn it over to the governor, who's going to take some questions. So thank you so much.
I'm going to be following fast right behind her to Springfield. So anyway, happy to take any questions from members of the media. Brendan. Well, maybe we ought to start with what the purpose of the bill was, which was to protect children and families and adults and the people of Illinois from very unsafe, intoxicating hemp products that are sold without regard to the age of the purchaser, without regard to the ingredients that are inside those packages, that are being sold at convenience stores and at gas stations, and that we already have seen children go to the hospital for. And adults too. And I talked to a mother of a daughter who took one of these packages, didn't understand how intoxicating the package was, and ended up passed out, ended up in the hospital, has been in and out of the hospital now for 8 months as a result of just this product that looked, you know, for all respects, as if it were candy. Some of these products, if you've ever seen them, it'll say Skittles on the front with a Z on the end. They're not Skittles like the ones that you know, but rather this intoxicating hemp. So what we're trying to do is keep people protected from products like that. This is about consumer safety and health. I was tremendously disappointed that this is a demonstration, from my perspective, of the power of special interests and the money that they spread around to thwart health and safety of the public. And, you know, this was the choice by a number of people to, you know, go for profits over people. And I was disappointed to see that. Now, I want to be clear. If this had come up for a vote, if the speaker had called this would have passed with a supermajority. We know that the vast majority of Democrats were in favor of it, and the vast majority of Republicans were in favor of it. So the fact that it didn't get called a bipartisan bill to safeguard the people of the state of Illinois is a tragedy. Yeah, Isabel. We're looking at all the options that are available to me in the executive branch to secure the safety and health of the people from these intoxicating hemp products. And I want to make clear to everybody, because I know the other side on this, people who are advocating for these packages to be just available to everybody, that they've been making the case that we're going to shut down CBD oil or these shops that are good actors that are just selling products that come from hemp, which, by the way, I signed a bill to legalize in the state to make sure that the hemp products could be sold here safely. And they found a loophole to jump through. But the people who are doing it safely and who are providing products that many people use day to day are not the ones who are at fault here. It's others. And so I want to make sure that we're using every possible power that I have in the executive branch to deal with it, but it does take legislation to do some of the things we need done. Yeah. So for those of you who don't know, we were invited to bring our experts from our departments to the House Democratic Caucus meeting to present to the members and to answer questions of the members. These are professionals. These are really top-notch professionals. No political anything involved. They literally were there to answer questions and to provide information. And they were berated by people who were opposed to the bill. They were berated. They were called liars. They were treated extremely poorly. One of my staff people had to get up and leave because she felt ganged up upon and called a liar and pointed at. And I mean, it was frightening for her. And so I have to say, treating staff people like that, I mean, politicians can take it. Politicians are, should be made of enough steel to deal with. These are professionals, and that we want to attract to state government. We want to stay in state government. To have them treated poorly by elected officials is, frankly, unacceptable. And I told that to the speaker. I have made it clear that people owe my staff, those staff people, I say my staff, these are people working in our departments, they are owed apologies by the people who impugned their honesty. I'd like to say that there have been easy years since I became governor to get things done. We've been going after big things. Balancing the budget in the state of Illinois is never an easy thing, but we've done it for 6 years in a row, and we're going to do it again. But yeah, there are big challenges to overcome, and certainly what happened with regard to the hemp bill is potentially a demonstration of challenges that the House will have in organizing to overcome some of the challenges that we're going to face this spring. Sorry, Shia Kapos, yeah. When they reach out to us to ask to meet or to talk about any particular topic, and remember, we've got cities and towns all over the state of Illinois that I engage with. Chicago is certainly the largest, but we have lots of mayors and county board members and chairs that we talk to. Whenever they reach out, we talk to them. And the same is true with the mayor of the city of Chicago and his staff. They don't reach out very often, and it seems like they don't have good relationships in Springfield, in part because they don't do the outreach that's necessary. But again, I've taken calls from the mayor whenever he has my direct number. He calls me whenever he needs to. He doesn't call very often. Maybe in the time that he's been mayor, he's called me perhaps 5 times. That's about 2 years almost. And I have no reticence to call him if there's something that I want to raise with him. And my staff doesn't have any reticence. But look, the lines of communications are open, but people have to take advantage of the open communication line. And often that didn't happen with regard to the hemp bill. Didn't call anybody in my administration. Never raised it. And with regard to his budget, literally the last call that we got from them was in September, and then once in December, we by the way, scheduled calls, and then they didn't show up. And then there was a December call that happened in which they didn't ask for anything. They just got on and, reported on what was in the budget. And then no other communication. But again, he has my number. They have all of our staff numbers. We're open to anything they would like to talk about. No, in fact, I don't think people lied. I'd like to think that people didn't lie to us. They told us that they would vote for it, and indeed, there were many, many people ready to vote for it. And as I told you, if you put this up to a vote, you get a majority of Democrats and a majority of Republicans that would vote for it. And this is an important issue. I wish it had been called. I think not calling it was irresponsible. I think that the mayor, my impression is he didn't have much to do with this. There's a powerful lobby that has been, working against this bill for quite some time. This was not an easy bill. If it had been, it would have passed last May. When it passed the Senate, they would have passed it in the House. They worked hard in the House to keep it from getting a vote in May, and in December, I let people know that I thought it was important for us to get this done this year, because every day that goes by, there are people buying these products, and there are people whose health is being put in danger with these products. And so like I said, it's a tragedy that the bill didn't pass. The mayor had very little to do with the ultimate result. I think there was a raucous meeting of the Democratic House caucus in which there was a lot of yelling at staff by people who were opposed to the bill that the speaker did not intervene about. And you shouldn't let staff get berated like that. You just shouldn't. Oh gosh, I think the long-term impact of these kinds of investments, this is a capital investment. I'd like to ask Rebecca to come back to talk about the impact here in the community, but I'll just say from my perspective, when I look at these projects, I think about the fact that we're trying to make, the word transformative isn't an accident. The idea here is that we don't want to just, well, here's a little money for your budget for next year. This is about having a broader impact on the community that will last lifetimes. And so I believe that the decision-making has been made along that line. Transforming healthcare in our state has been vitally important. It's taken us years to make progress, partly because no progress was made for some years before. And so we were like in catch-up mode, and now we're making the capital investments that are necessary. I want to remind everybody, by the way, the operating budget of the state is different than the capital budget of the state. And so that's why when you hear about challenges of passing an operating budget or balancing it, which we do every year, and we will do it again, we'll balance the operating budget. But it's different than when we talk about $200 million being invested. This is long-term. This is going to last for hopefully decades. But I want to ask Rebecca just to come back and talk about the impact of this investment.
Thank you. The impact for this investment for us is really going to take our community to the next level in healthcare and in our education and our support services by having everything under one roof. It's really going to address our critical gap that is for the access and equity to fulfill our mission and empower our individuals and our families that we serve. And it's really, we're hoping to expand our reach and strengthen just our own partnerships within our community to have great person-centered care and ultimately ensuring that everyone in our community has the support that they need to thrive. So.
It makes you wonder, doesn't it? If Vivek Ramaswamy, whose partner is Elon Musk, who is in a rival electric vehicle company, if there isn't some self-dealing going on in the advocating for taking away something that is helping to build the industry that would help other car companies. And the two that you mentioned, Stellantis and Rivian, are just two good examples of those are competitors of Elon Musk's company. Look, we're fighting like heck and we've, I think, done a lot here to solidify the Stellantis grant that would come and the loan to Rivian. And we've talked to Rivian to make sure we're doing everything we can to make sure that's secured for the future. I would find it hard to believe that they really want to put people out of work, that's what the goal of that businessman of Vivek Ramaswamy and Elon Musk really is, that they want to put people out of work. It's a fine threat. I hope it isn't the self-dealing that I'm referencing. And I can tell you that, I don't know if you saw the report, but Rivian beat the estimates for sales that they had, and that's a terrific outcome and something great. I think we should celebrate for the community. They're also building, as you know, they have a piece of property next door that suppliers are looking at moving to. That will bring jobs to the area as well. And I've talked to a couple of those suppliers. So I feel like, Rivian is very much on its feet and doing well. And I don't want the federal government to interfere with the success of any business in Illinois. Thank you.